Hair transplantation. Dr. Ennis here at Ennis Plastic Surgery in Boca Raton, Florida. How does a hair transplantation work? Well, first of all, let's look at what causes hair loss. For some reason, in some people, the hair on the top of the head is programmed to fall out. We're not sure how to make it come back, but we do know what causes it to fall out. There's a molecule called DHT, dihydrotestosterone, which turns the hair follicle off and causes the hair to essentially shrink down and eventually stop growing. We know that if we block DHT, we can postpone and prolong the hair loss and put it off as long as we can. So by using two different mechanisms, one is Propecia. Propecia is a pill that you take that blocks the DHT. The same medications you use for prostates. The DHT is what causes the prostate to swell, causing older gentlemen to get up in the night and go pee. Well, if you shrink the prostate by blocking the DHT, we also block the DHT in the hair, and the hair loss slows down significantly. Second is Rogaine. Rogaine is essentially minoxidil, but what it does, it increases the blood flow to the scalp, and also is a second way that we can help preserve all the hair that we can. So the first one to do is preserve what you have still there. So as soon as you notice that you're getting some hair loss, that your hair is thinning, we need to get you on Propecia and get you on the Rogaine. After that, how do we replace what's gone? Well, again, we know that the hair on the back of the head is not responsive to DHT, is not caused to fall out. So we can transplant the hair from the back of the head to the front. Now, there used to be, there was a big incision across the back of the hair where the hair was harvested, called the strip method. This was where we took the hair and took a big strip of hair out and cut the hair up, put them back individually. The downside that, unfortunately, there was a big scar. Now we have the advent of several new technologies, such as the NeoGraft machine. So the NeoGraft machine allows us to harvest one hair at a time. So with this machine, we can go in and individually take out one hair at a time and then put them back in. So you can see in this patient, who's only about 2 weeks after surgery, has no scar at all. This is all fresh transplanted hair here on the front, where this has all been filled in. Now, how long does it take the hair to regrow? Hair is a little bit like planting seeds, not quite the same gratification as a facelift or a tummy tuck or breast augmentation, where you sort of get this instant gratification. Hair transplants like planting seeds. You got to plant the seeds and let it grow. So when you first see it, it's like a little chia pet. You got all these nice little hairs up there. You're like, wow, this is exciting. But unfortunately, over 2 or 3 weeks, that hair gets stressed, and that the hair shaft's going to fall out. It takes about 3 months for the hair to really start growing back in. At 3 months, you'll see some growth. At 6 months, a lot more. It really takes 12 to 14 months to get full regrowth of all the transplanted hair to allow those hairs in the hair follicles to grow back. So plan on 3 months to see any growth. 6 months can be better. 12 to 14 months before you get your final result.